Some suicide awareness and prevention advocates have shifted to using the term completed suicide instead of committed suicide. And then I've also seen other things where people will just say died of suicide. So what is the correct way in which to talk about this?
Yeah, that's a very important question, and the question really centers around the experience of people who lost somebody to suicide. I always say die by suicide because ultimately they died by suicide. I think committed and completed, for people that have lost somebody to suicide, often feels like there's some intentionality in that. There's a great sense of shame, of guilt, of responsibility by people who lost somebody to suicide, at least initially, even if they recognize ultimately that this wasn't my fault. They sometimes feel that way, and it's easier to then say, if they completed suicide, that means they intended to do that and I should have been more aware of that. Or they committed suicide, which there was intention to that. It's much easier for me to feel like this was out of their control than to say that this was a choice that they made. And the problem is we never know exactly who we're talking to when we are talking about suicide. And so you don't know somebody else's experience. Lots and lots of people in this country know somebody who's died by suicide. So again, that's why I always talk about it as died by suicide, because you don't want to unintentionally hit somebody in the wrong place, and it can be off-putting to them, and you don't even know it.